Hello everybody, I am Laura Gartshaw and I'm currently a Senior Lecturer and Honorary Consultant at the University of Liverpool. For me, it's very much about opportunities and diversity. So I have a very different working pattern each day and each month of the year, and there are parts of my roles that peak and trough throughout the year and become really busy, and then parts of the time during the year it gets a bit quieter. But there is so much opportunity to bring in additional roles, to find your own niche and to find your own area within academia. And I'm really glad that these videos are happening, because actually I don't think I fully understood that before entering this career pathway. I think I used to think it was all about research, and whilst I'm involved in research, I'm involved in a supervisory way, whereas I have some significant roles in teaching these days. So for me, it was a lot about that, and also the opportunity to build in external roles that suit as well, and to basically manipulate my own time. But as I say, it does change throughout the year, but my set timetable as such is that I have 2 full clinical days. And as an SL honorary consultant, I would recommend that you do try to work towards that if you can. So your job planning meeting each year as an SL honorary consultant will usually be with the head of school as well as with the clinical director, if you're in a similar role to me. And at that meeting, you can try to manipulate that timetable. And if you can get your clinical roles together, it means that for 2 days, you can wear your clinical hat and the other roles can sort of sit quietly. And then once you've finished your clinical days, you can refocus again on the academic side of things. So for me, that works really well. It also, of course, works well if those days are consecutive. So for me, I have 2 full clinical days at the beginning of the week, and my time is supposed to be split 50-50. I make the age-old joke that actually it's more like 50-100, so 50% clinical time, but the academic side of things is always there. It is always ticking along. So you do have to be fairly disciplined in that respect. But on my clinical days, I find that my role as an honorary consultant is an extremely enjoyable one. I think it's very manageable for those 2 full clinical days. I have a new patient clinic, as most honorary consultants will. I have a teaching session where I supervise undergrads. I have a trauma clinic because that's something that's of great interest to me, and I also have a theatre session. You have to look very carefully at your strengths, and I know that sounds like a fairly obvious answer, but for me, I recognise that to be involved in research, the best way for me to do that was probably to supervise and encourage others to research, and that's definitely what's working best. My PhD is something I'm incredibly proud of, but it was a long fought battle. Whereas as a research supervisor for 3 postgraduate students, I am really enjoying that role and actually find that I'm able to support them in that in a very directed way. And I can also support undergraduates, learners who are doing sort of mini research projects, and I've taken on the research methods module for the undergraduates and postgraduates too. So you can stay involved in research without having to actually necessarily be active in it, if that's what's best for you. When it comes to teaching, it's some people's bag, but not everybody's. It's actually something I came to very late, which may be a surprise, because I am in that role as BDS Programme Director now. So I think you really have to be very open-minded and carefully consider all of the opportunities available to you. I think recognising who you consider to be good leaders is key to making good career decisions, because if you watch others and learn from others around you, then it helps to support those decisions. I was lucky enough to do a 1-year fellowship with the Royal College of Surgeons for leadership. And again, that's something you can quite easily build into an academic career, and it just helps to get your sort of lateral thinking underway as to different things that you can do. And there may be far more opportunities available to you than you currently realise. So really it's just a matter of suggesting that you consider all options.